Thanks, Jeff, and thanks for the Academies for putting this together. This has been a really great day. I've really enjoyed listening to all the panels, very thought-provoking sessions. I guess I'll just lay out a few themes that I heard across the day, over the course of the day, and maybe try to draw a couple of connections and maybe fill in with a couple of ideas or things that from my own vantage point that I think are important or could use more emphasis in some of what we heard. So I guess sort of three big buckets that I wanted to talk about. One is I think we heard loud and clear from the morning session that the morning sessions on digital health technology and AI and ML, machine learning and research and care, that these things are placing enormous pressure on our current privacy and ethical and regulatory frameworks. And that we are going to need a new system, and it's actually not just we are going to, it's actually quite urgent. And that if we are serious about embedding bioethics into these things from the start, we're already behind the task. And so I love the way Michelle laid out sort of a number of the ethical issues and bucketing them into sort of old problems and new problems, but even the old problems are sort of old problems on steroids, like reuse of data for purposes that weren't anticipated or intended when first collected or generated. This is an old problem that we've all seen with reuse of genetic data, for example, but this is so much bigger in this world of emerging digital health technology and machine learning and everything else that we heard. And new problems like her provocative statement about the end of anonymity. I mean, I think we all, I think in this room at least, probably can agree that de-identification is really just not sufficient anymore. So we need new laws, we need new system architecture. This is going to be enormously challenging, and I'm not quite sure how we're going to get there. John Wilbanks made the point that he's not going to put his bet right now on Congress. So what do we do in the meantime, I think is a huge question. But in the very least, in the meantime, we need to get ready for what that's going to look like. And there's a huge opportunity to start mapping out that framework now. So I would love to see research on that funded that like really is getting at what does that framework have to look like. And that kind of brings me to point B, which is we also heard people saying that there's an enormous challenge in developing the rules of the road and new standards to apply to things like, AI and machine learning that's applied in clinical decision making. And that's because in part, I think Suchi and some others and Pilar made the point that none of the stakeholders involved have really a full set of expertise. So regulators haven't really had much experience with the technology because it's so new. I don't think that's entirely a new problem, but it's maybe this is moving so fast that it's a special problem here too. And technologists don't have the ethics training. And, Pilar made the really elegant point that you can't just broaden the circle of trust to, say, large tech companies, and because the norms of these companies very, very, very different from those of trained ethicists or clinical researchers or other stakeholders in this space. So what are we to do? I mean, I think there's just an enormous opportunity for new kinds of institutions, new kinds of collaborations that are not just multidisciplinary, but multi-institutional. Like, I'd love to see tech companies, folks at tech, it's not just like tech companies should go hire a bunch of bioethicists. I'm not sure that that's really the right answer, although that's probably important too. But we need to have spaces where people can come together, learn each other's languages. And it's one thing that I really love about working at CZI, because I think it is a foundation that's trying to do a little bit of that in bringing together technology, pairing grant making with not just a typical traditional philanthropy, but actually bringing together grant making along with technology. So I work every day now with data scientists and engineers, which I'd never really done before in my past career, along with scientists and policy and advocacy people. So that's an example of an institution that's trying to do something a little bit differently, but I think we need a lot more of that and a lot more experiments in that space. Second sort of broad bucket is the citizen science and sort of panel and alternative approaches to data collection. That's another space where we're challenging our regulatory frameworks and ethical frameworks. There was a lot of discussion on that panel, I think, of N of one type projects and citizen science to the extreme of like individuals trying to take charge of their own care. But Eric showed that wonderful slide of that there's a growing number of projects that are on a spectrum. And what really interests me are the community-driven and the patient-driven research projects that are sort of happening. And there's lots of different models out there of like what this can look like. It's important to understand these are happening because of at least perceived, if not real, gaps in research, where communities are demanding a more inclusive science. They're demanding a seat at the table. They're asking for more accountability of science. And we're asking for research to be more inclusive, more community-driven, more directed to their particular interests and needs. And I think that's a good thing, and we should embrace that, even if that's slightly uncomfortable, as people sort of alluded to today. So I think there's an enormous opportunity. We know that, for example, in kind of patient-driven research or patient-partnered research, we know that there can be enormous benefits to research and harnessing the actual insights of patients and their disease areas. It's an example of just public engagement in science more broadly, which can lead to more support for science. Co-development of knowledge can lead to very different kinds of knowledge that's developed that can be much more relevant to actually solving the interests and needs of the communities we're ultimately aiming to serve. So I think there's huge opportunity there, but there are lots of different models. And it's not very well studied, and I think there's a big opportunity. And there are huge challenges because in some ways, patients and patient communities are taking on more and more burden. They're broadening their roles and responsibilities in the research enterprise, and we have to ask whether that's really a burden they should have to take on, and if so, how can we help them take that on, and how can we make that more efficient? And it's somewhat uncomfortable, as Eric noticed, becoming the note taker in that meeting. I love that comment. And Vanessa talked about, the community leaders being the ones to define the research agenda or define research questions or define what respect and reciprocity and harm might mean in the context for their community. That's enormously important, but it can be uncomfortable for the research community. So how can we embrace these new models of research? Which ones are most effective? What can it actually look like? That's something that's enormously important to me. Last point, do I still have a minute?
No.
Oh, 30 seconds.
Pass. 30 seconds over.
Okay. So I'll stop at that. I'll make my last one next. I'll make my last point during the discussion, I'm sure.
Thank you.